I'm really happy to be here and happy to be part of the growing group of people who are really excited about what Hope is offering to all of us who are really out there in the field working to create a better life for kids and families and for everybody all together. Okay. So this session is about the Hope Innovation Network, and there are a number of handouts that you should be able to access, and we'll make sure that everybody can do that at the end. It includes this PowerPoint. It includes some information about the Hope Innovation Network members, and it includes two little pieces of information that we've shared with the Hope Innovation Network as they get started doing what it is that they want to do. It's really exciting to hear where everybody is and how great your expectations are about this Hope Innovation Network. And I want to say from the very beginning that we are at the very beginning in terms of really understanding how Hope can play out in the variety of different kinds of settings that all of you represent. And we'll see who it is from the Hope Innovation Network may be here just a little bit later in the PowerPoint. So let me see if I can, there we go. I included a number of the slides that are really about Hope, but I think that all of you, given the reasons that you're here and want to learn about it, already know a lot about what it is that we're trying to accomplish through Hope. And I think that just the very idea that you understand enough about what this is about to be really interested in how that plays out on the ground. One of the aspects, and I think this goes back to what both Bob and Daryl talked about earlier this morning, we know that positive experiences are so important. And it's through all of these different kinds of positive experiences that all of the organizations that are involved with children and families are trying to accomplish. And I think that the issue behind Hope and the reason that it's so important for us to begin to do this in such a strong way is partly because we say we understand that positive experiences are so important, but all of the information that we collect, all of the reasons that funds come from wherever they come from are all about the negative, and they're all about identifying what it is that's wrong to get people to move forward with providing the kinds of services that a number of you represent. And that's not to say that that's not very important. It is very important, but prioritizing that undermines the importance of those positive experiences. And what Hope really wants to do is to shift that narrative and begin to consider, not just consider the positive experiences, but to promote them as essential to the way that we begin to think about what it is that we're actually trying to do. And again, you've seen the 4 building blocks of Hope, and this is one of the things that I think it's important for. It's an important contribution that that does describe what we really mean by those positive experiences. And we'll come back to these throughout our conversation about how people are beginning to actually implement Hope, and in their own very different, in some cases, places where they're working. Now, this in many ways is the Hope theory of change. And I was really happy that in the introductions that people started to flesh that out in terms of all of you who are who are in this session today. And Hope really depends on all of these different aspects of the work. somebody mentioned the fact that families themselves are really important, and their voices, their experiences, their knowledge, the way that they understand their lives and their children are absolutely at the core and is number one on the list of what makes this possible. And sometimes I think in our work as professionals, we tend to think of family second, not first. And when we begin from where families are, then we begin to have a more authentic and a more hope-oriented way of working. Child and family serving practitioners, which many of you are or represent, are absolutely essential. They're essential partners with families for families to be able to create the kind of positive experiences that their children need. And those practitioners that you represent are also the people who interact with community leaders. And the community leaders, when we don't want to forget that community leaders are also families, and that the families that you work with every day can be and often are community leaders in their own communities. So we're beginning to put together the pieces, the elements of what really begins to create the kind of hope-informed movement that we're hoping all of this comes out to be. And again, a couple of you mentioned that that's your purpose in being here, to begin to be a part of that movement that begins to shift the dynamic from focusing only on negative things, tracking only negative things, seeing only negative things, to a balance of figuring out how we also understand the positive aspects of the lives that families and communities live. So in terms of what HOPE is doing and what the national effort is collaborating with all those different kinds of people. And you've heard different mentions of that already in the two introductory conversations that you listened to earlier today, that it is focusing on children and families and ways of making sure that families' voices and children's voices are prime in the work that we do. Allied organizations, which many of you represent, child and family serving practitioners. And practitioners and organizations aren't always the same thing. Part of the practitioner part is understanding how to train people differently so that they are able to serve with hope those new allied organizations that we hope to come to be a part of this movement. Researchers are one thing that I think is really important to acknowledge. And this is one of those areas where we begin to realize that the focus of so much of the research that we build our services on and our policies on are all about the negative things and not so much about the other side of the positive experiences that are really essential for children to thrive and for families to be able to do what they need to do. Child and family advocates and policymakers are another audience for the work that we hope that we'll be doing as the HOPE Innovation Network begins to get going. The policymakers depend on child and family advocates, on community organizations, on researchers to be able to create the kinds of policies that are going to be helpful in making sure that there are opportunities for children and families to experience services and communities that are really oriented toward healthy outcomes. And I think this is just a little quote from Jeff Linkenbach, who many of you may know. And it's a way, in some ways, I think that hope is a way of seeing. It's a way of changing the way we think, the way we operate, the way we do our work, what we look at first, instead of what we look at second. And it has a huge impact when you start to look at it from that perspective, instead of from the perspective of what's wrong. what are the deficits that we're trying to remedy. This is the whole, and you saw Bob put this slide up earlier in terms of all the different elements of what it is that HOPE is doing. The HOPE Innovation Network is really in this little circle over here. It's about changing practice. And the Innovation Network is certainly by no means the only network of people who are changing practice. And what we hope is that all of you who are out in the field working every day with kids and families will also be a contributor to the HOPE Innovation Network. Right now, it's a very small group of people who raised their hands and said, we really, really want to do it. And we're just now beginning to learn what that means and how to help other organizations who are really there at that intersection of communities and families. And we'll talk just a little bit more about it. And I should say it's really important to recognize that the HOPE Innovation Network really started in January. We've had exactly 3 meetings so far. People have begun to do some work and to begin to tinker around with some of the things and some of the tools that may help us all figure out how to move to the next step. So this is just a little explanation of what the HOPE Innovation Network hopes to be. And that is a collective understanding. And the reason that the first partners were selected is because they represent a pretty wide range of the different kinds of organizations and practices that are intended to be a part of the bigger HOPE network. And what we hope will happen as we begin to work together and drill down into what does that really mean to be part of HOPE, to do in real life what it is that it's easy to talk about it, but it's a lot harder to figure out how do you really do that? And how do you, where are those small places that you can begin to shift what it is that you do, the way that you think, and the way that you portray what it is that you're trying to do happens. So this is a little bit just about the process and goals. So a few, as I mentioned, a few brave people raised their hands and said, you know, we would like to be a part of this initial network and begin to utilize and explore the ways that it can be utilized, that HOPE can be utilized in real life. And as you can see on the slide, there's a pathway that's just at the very beginning point, and the place that it hopes to go is a long way from where we are. And again, I think it's important to understand that that's where we are. These are the initial members of the HOPE Innovation Network. And you'll see that, that they represent very different kinds of organizations that have different kinds of missions and different ways of beginning to implement HOPE in their work. And I'll just go through them. And if we can find, I don't know how many of the network members might be on here. And maybe Keisha can help me unmute the representatives from these organizations if they're in the session today. The first one is the Children's Trust of Massachusetts, and particularly the Massachusetts Healthy Families part of what the Children's Trust does. And the focus of the work of that particular part of the work that the Children's Trust does is a home visiting program. The Resilience University in Lewiston, Maine was started by one single pediatrician. And in trying to figure out a way to describe to the patients in her practice she came up with a terminology of resilience university. And this is a way of defining what it is that the parents can hope to get from a pediatric practice that's really focused on helping families do what it is that they need to do. She's also a part of the main group of the American Academy of Pediatrics. And this is one of the areas of work that is an important representative of one of the arenas that we hope that the HOPE initiative begins to penetrate into. The third member is the Lake of the Woods Coalition in Lake of the Woods, Minnesota. And Lake of the Woods represents what is a substance abuse prevention, community-wide substance abuse prevention effort that's also focused on creating Lake of the Woods as a place where every child can grow up with positive experiences. And that's, again, a different thing from a pediatric practice or from a home visiting program, but one that really is focused on mobilizing a whole community around the goal of creating a positive environment in their community. Vision for Children at Risk in St. Louis is directly a community engagement organization that has been at work for quite a long time in St. Louis and has a reputation for really engaging people in that local community. And one of the places that one of the strategies that they've used to engage people in the community is the parent cafes that emerged from the Strengthening Families work some time ago. And one of the challenges that they've been having is trying to figure out how to connect with parent cafes and with the people who've been involved and engaged in the work that they've done during the pandemic, which has created the need for some different ways of reaching out and beginning to develop a whole agenda for the children at risk in St. Louis. The next one is the Gardner-Packard Children's Health Center at Stanford, particularly the part that is actually training new pediatricians. And they have begun this process of incorporating and beginning to focus on HOPE as a central core of the way that they're training pediatricians. And we had a funny report from the person who is managing that, Baraka Floyd, at the last time we had a network meeting. And she was laughing to say that when they started to roll this out in the pediatric training, two things happened. One was that another group that was not involved in the training that they are getting came into a room where they left on the whiteboard the information that they had used in the last session, and the subsequent group that came into the room after this group had already gone was so interested in what they saw on the whiteboard that they wanted to have the same kind of training for themselves. So we'll see if it continues to be one cluster of those pediatricians in training, or it gets expanded right away to the rest of the people that are involved there. The other thing that Baraka shared in the last meeting was that what really dawned on the people who were going through the pediatric training was, oh my goodness, we need to spend a lot more time talking to the parents who come into our clinic. How are we going to do that if we really are going to focus on what's right, what's hopeful, and not just on what might be wrong? It's going to take longer to actually make that happen. And it was an aha moment that really represents the kind of change that can happen once you start to think about creating a different mindset, a different framework for approaching the work that you do. The final member of this, the initial member of the Hope Innovation Network is the YMCA Child Care Resource Service in San Diego. And the YMCA in San Diego does provide both child care and the ways that parents can get child care in a pretty routine way. It's the kind of network that exists in many different kinds of communities. But they've gotten very intrigued with the notion of being more than, or utilizing the platform that they have to be much more engaged with the families that they serve as a resource and referral agency, to look more carefully at what the goals are for what those families' goals are for themselves and for their children, in ways that begin to change what it is and the way it is that they provide the services that they have. So those are the initial members of the network. I wanted to go back just for a moment to the 4 building blocks of hope in the context of those kinds of organizations that are at the beginning of trying to figure out how to build these 4 building blocks within the confines of the work that they're already doing, paying much more attention to the relationships within the family and with other adults and children, really paying attention to the safe, equitable, and stable environments that those families live in. The social and civic engagement, you can hear that through the things that those organizations are doing. And the emotional growth that children need through playing and interacting with peers. And that has to happen within the context of relationships that families have with each other, with environments that are safe and welcoming for those kids, and for the kind of engagement that's necessary for them to be able to have those experiences that they need. So this is how we're seeing the building blocks play out in these places where we're working. One important aspect of the Hope Innovation Network is evaluating what that means and learning very carefully from what it is that those organizations are doing and how they're doing it, so that we can turn that around to the next group of people, who some of whom may be in this session right now, to begin to actually make this work. And I'd like to ask Jessica Greenstone to talk just for a minute about the evaluation that the Tufts Interdisciplinary Evaluation Group is going to do for the Hope Innovation Network. This will give the rest of you some ideas about what to expect, the kind of information to expect from this very initial beginning of the network.
So my name is Jessica Greenstone Weinstone, and thank you so much, Judy, for inviting me to be a part of this session today. We've been working with Hope for about, I think, 7 months now on an implementation evaluation. And by we, I mean the Tufts Interdisciplinary Evaluation Research Group. We're at Tufts University, not Tufts Medical Center, but we're really thrilled to be partnering with Hope. And this is a really critical time in Hope's programming to be thinking about implementation evaluation, because they're bringing their work to scale, and they're in the earlier stages of trying to develop their trainings and their materials and figure out the best set of to be able to roll out Hope on a wide scale. So it's really wise of Hope to invest in implementation evaluation at this stage, because it's really focused on utilization, and the benefits from implementation evaluation can come from learning about the processes that are involved in transferring knowledge to individuals and organizations. So that's one evaluation lens that we are bringing, is to really work with Hope in partnership to figure out how to hone their products, their delivery formats, to reach a wide range of individuals effectively, and also understanding the processes involved in implementing Hope-informed knowledge and approaches. So another lens is looking at the organizations, such as those that are part of HIN, that are receiving training from Hope, either through a workshop or through the various resources Hope offers on its website, and trying to understand whether, through both of these lenses, trying to understand whether there can be strengthening of Hope's programs, and also what we can learn when we're thinking about implementing Hope in a very diverse array of sectors. As Bob said this morning, Hope is really for everyone, which makes it a really exciting and hopeful program, and also adds some complexity when we're talking about evaluation. So what are the various ways of implementing Hope? What will it look like in a substance abuse prevention organization versus a child abuse prevention organization versus a home visiting organization? It may look many different ways. The way that it makes sense to implement Hope with families in those settings will vary pretty broadly. And our third lens is, how do participants feel that they are benefiting from Hope exposure? It's quite early on in the process, too early to really measure specific outcomes of Hope implementation. And instead, we're trying to identify at this stage, what are the potential outcomes of Hope? In what areas or what signals should we be looking for when a little further down the line, we're actually trying to collect data on impacts on parents, impacts on children, impacts on parent-child interactions, and also thinking about the providers and administrators who are delivering these programs. What kinds of impacts does it have on providers? So a provider who interacts with families that are experiencing challenging circumstances and may have, personal and professional impacts of being exposed to those things. How does it feel for them to be implementing the Hope framework and focusing a little bit more on strengths and the positive experiences that families already have? So we're really asking questions such as, how do organizations that receive training translate Hope into practice? What implementation successes and challenges are they experiencing? And what are providers observing once they're actually implementing Hope? And we have a variety of mixed methods evaluation approaches, including doing focus groups and interviews with providers and parents, and several types of surveys, including one that's focused mostly on what people are gaining from Hope trainings and workshops, what people are experiencing once they go back to their organizations following a workshop and try to implement Hope, and also what parents seem to be benefiting, what changes they seem to be noticing when they're working with providers and organizations that are implementing Hope. When it comes to HIN specifically, we're really looking at a few different things. First of all, in terms of implementation, we're thinking about the processes of implementation. So what does it look like step by step when an organization begins to implement Hope within their unique program setting and within their unique population of parents and children of families? So what can we learn about the various ways this can be done, and how can Hope use that in its trainings going forward? We're also interested in learning about the successes and the barriers to implementing Hope. And, we're interested in feeding this back to Hope as well, to eventually incorporate some of those lessons into the trainings and their materials going forward. So the ways that we're doing that are by observing the processes at HIN meetings. So really watching as people from month to month are kind of undergoing the process of figuring out how hope fits into their organization, engaging in the process of, changing their mindset, which is really at the core of what hope is about. And so we're watching and we're documenting that. We're also focusing on a couple HIN organizations in particular, which I will quickly walk through. So one is, when we're thinking about the various kinds of organizations. So there's one HIN member that's an early childhood education organization, and they received HOPE training and were extremely excited and enthusiastic about implementing the HOPE framework, but they started to struggle a bit with what are the first concrete steps they should be taking. And so we developed this 3-month follow-up survey to help understand, first of all, what do they know about HOPE? It's been a few months since the training. What is the knowledge transference, and has it been sustained? And can they kind of name how to apply the HOPE framework in practice? And secondly, we wanted to know what they've done, if anything, in terms of implementation, or what are they planning on doing? They also then had a meeting with HOPE just to kind of review what was learned from the 3-month survey, and we observed that meeting. And it was a way to identify the facilitators and the barriers to implementation, as well as any needs for assistance or resources. And so that is a way similar to within the HIN that HOPE was able to really kind of scaffold the work that they're doing. And the second organization I wanted to highlight is a pediatric clinic, and they have a very intentional plan to roll out HOPE over the course of 1.5 years. And we are interested in documenting that step by step through interviews with the administrators and the providers who are working on that. So what does it look like? What are they experiencing as they work to implement it? Hurdles might they have to jump through or jump over, or what kind of reframing do they have to do, not only in their way of thinking, but in terms of how their organization is used to running? What kinds of shifts have to occur? And so we are talking with them. We're also trying to identify perceived impacts that they're noticing, both on themselves and their interactions with families, as well as on families directly. And we plan to distribute a pre and a post parent survey to get the parents' impressions of what they're observing in terms of impacts on them, maybe their self-efficacy or their levels of parenting stress. And because children are so young in this study and we can't rely on any direct data, we'll hear from parents what they think the impacts are in their children. And I did want to share, if I can advance to the next, from one of the HIN members, and just kind of encapsulating what she has seen as the benefit for her, and she is a pediatrician. She said, HOPE is providing an opportunity to have the parents be proud of things they are doing well, instead of focusing on areas that need improvement. I feel this has increased their willingness to engage and work with me. And, this is a wonderful quote just on its own, but it also highlights the potential areas of impact that we as evaluators can start to recognize and look for in other organizations. And that includes, the impacts on parents and the impacts on providers and the provider-parent relationship. So I'll just put up our website address and the contact information for myself and the principal investigator on this study, Ann Easterbrooks, if that will actually come up. And if it doesn't, I will stop sharing because I know there's a lot more that you would like to cover, Judy. Enter this information into the chat box. So thank you so much.
So it looks like that information is there, and we'll be able to provide it to people later if you want to do that. So I'm going to share my screen again and give you a couple of things. Uh-oh.
There's just another delay on my end with the stopping of the sharing. So it's just a spinning circle. Hopefully it's been, hopefully it will take it. Sorry about that, Judy.
No, it's fine. It seems like every time I do this, there's some other way to do it, or that it needs to be done.
I wonder, Keisha, I don't know if you've already taken host powers away from me, but that might get the job done more quickly. I'm waiting for this to close.
I haven't, but I can share the remainder of the slides. Like it's just the same slide deck as like in the auditorium template.
Yes.
Okay.
So the slide that I'm looking at now is this one with the little kids that says what we do on it.
Okay.
Is that right? And I just wanted to mention a couple of tools that we've used with the Hope Innovation Network to help them get started. And one of them is a readiness assessment. And I think all of you who have ever worked with any kind of change work know that it's really important to begin to assess how ready people really are to change. We can talk all day about what it is that needs to happen and the change that we're trying to make. But if people aren't ready to do that within an organization, then it's really hard to make that happen. So we utilized a tool, the Organizational Change Recipients Belief Scale, and had each of the organizations do that. And they, we compiled all of the answers and helped the teams analyze the overall readiness for change within their organizations or within the area of the organization where they were working. The next thing that we did was to utilize, and I think these two things are actually in your packet, it's sort of a little form that you fill out that's about a SMART aim, and to help people begin to look at the specific, and SMART stands for specific, measurable, attainable, relevant, time bound. And this way of thinking about it helps you to begin to narrow down. I mean, I think the challenge is always that once we get really excited about doing something, then you've got to focus really specifically about what is that? You know, what are you really trying to accomplish? How are you going to measure it? Is it really attainable? Is it relevant with everything else? Is it the right time? And what's your time frame? It's just a more organized way to start to think about that. And then I think the next thing is to really think through what that change is. What are the challenges? What are the opportunities? What do you need to make that happen? And one of the ways that we helped the HIN members begin to think about that is to talk about it. We used to talk about it in Strengthening Families as identifying small but significant changes. You can't change everything all at once, but you can pick out a few things, or maybe if you really think through it, one or two things that will then create change for some others. And that handout is also in your in the packet of information that's attached to this session. So these are, we've kind of rushed through at the end, and I'm sorry for all of the challenges. But I also wanted to just leave you with these guiding principles for positive transformation. And I think all of you, just in your introductions, had talked about elements of this kind of positive transformation that you're trying to make where it is that you are. And these principles are always a good idea to sort of keep a copy of that on your desk, particularly at the times that you feel either we're way behind what we need to do, or there are these people out there who just don't understand what we're trying to accomplish, and to begin to think about it in what we would say is a really hopeful way. So the next steps, let's move to the next slide, Keisha. If you can, yes. One of the things that is going to happen, and this is for those of you who are willing to keep following the progress of these current members and have an inclination to want to raise your hand to join the Hope Innovation Network. And we, depending on funding and some other kinds of things, we may be able to expand the membership later in 2021. So stay tuned if you're interested. And you can also send a message to Bob Segi or to me. Somebody has already sent one to me. And we'll be sure to get in touch with you when we get more organized about what the HIN is going to do and expand its membership in 2021. And obviously, I think I really appreciate Jessica's good explanation of the kind of really close evaluation and tracking of what those changes are from the very beginning. And I think that all of you who've worked in this arena for a long time know that it's one thing to imagine change, and it's another thing altogether to actually make it happen, especially when we're working in an arena where so much of the information that we have and the way that people track it is not in the way that we wish it would be. And it really takes all of the work of actually showing how it works to do it differently and to move the needle on creating a move. Not just, it's not ignoring the negatives, but to really put much more attention on the positives. And I appreciate your staying with us and being interested in the Hope Innovation Network. And you can contact anybody at Tufts, or you can get in touch with me directly. So thank you very much for joining.